Texas blocked the US Food and Drug Administration, the FDA's approval of mifepristone, threatening the 22-year approval of the medication. One of two medications used in the most common medication abortion regimen in the United States. However, the judge also stayed the decision to give the federal government 7 days to seek relief on appeal, which means that for now, approval of mifepristone remains protected in New York. In a separate ruling, a federal judge in Washington issued a preliminary injunction in a mifepristone case brought by 18 attorneys general. While a lot of this remains unclear, the two rulings between the two rulings right now, the approval of mifepristone remains protected. This afternoon, you're going to hear from Planned Parenthood of Greater New York President of CEO Wendy Stark about the potential consequences of the decision, and Dr. Gabriela Aguilar about the safety and effectiveness of the medication abortion and how Planned Parenthood of Greater New York will continue care no matter what. We are also joined by Niharika Rao, co-founder and lead organizer at Reproductive Justice Collective New York, a grassroots youth-led advocacy group lobbying to secure medication abortion on college campuses. All the names, titles, and pronouns of our speakers are available to you in the chat. We're going to open the floor for Q&A following the remarks. We've got several electeds here with us as well. We're really excited to have here with us. Please hold your questions until after they speak. I'm going to hand the mic over to Wendy, President and CEO of Planned Parenthood of Greater New York.
Thank you, Deepal, and good afternoon, everyone. Once again, a hostile court has decided to shame and punish people for their pregnancy outcomes. And once again, medical professionals are being forced to overcome unprecedented challenges to provide compassionate care. This lawsuit is not about the FDA's process to approve a safe and effective medication. It is simply another cruel attempt to compromise abortion access through our broken court system. And this time it has hit close to home in New York, where abortion is safe, legal, and readily accessible. A Texas court has no business interfering with access to healthcare in New York, and abortion is healthcare. The court's egregious decision to rescind the FDA's approval of mifepristone prohibits Planned Parenthood of Greater New York, along with healthcare providers across the country, from using mifepristone for medication abortion, at least for now, because we know this fight is far from over. Let me be clear, this ban on mifepristone does not end access to medication abortion. Planned Parenthood of Greater New York will continue to deliver on its commitment to care no matter what by offering our patients the full range of abortion options, including in-clinic abortion and medication abortion. If mifepristone does get taken off the market due to this baseless lawsuit, we are prepared to use another safe and effective regimen. In a few minutes, you will hear from my colleague, Dr. Gabriela Aguilar, about the safety of medication abortion and about this misoprostol-only regimen, which is commonly used for medication abortion globally. While Planned Parenthood of Greater New York has positioned itself to continue uninterrupted patient access to medication abortion, we must also grapple with the far-reaching consequences this will have on people who are trying to navigate the complexities of this post-Roe world. The US Supreme Court's dangerous decision to overturn Roe versus Wade has put abortion care out of reach for 1 in 3 women and many more transgender men and non-binary individuals. For the past 8 months, we at Planned Parenthood of Greater New York, along with our partners in healthcare and abortion access supporters, have been helping people from across the country connect to care in our state. We know that further abortion restrictions, like the ban on mifepristone, will only compound existing racial, ethnic, and socioeconomic health inequities. This reaffirms why we must continue to intentionally center marginalized communities in our healthcare provision, education, outreach, and advocacy. We are so proud to be part of an ecosystem of healthcare providers, educators, advocates, elected officials, and supporters who are fighting for a more just and equitable future. Much like the Dobbs decision last summer, this news will and has already overwhelmed, confused, and heightened fear within the communities we serve. We want to send a loud and clear message to our patients. Abortion is healthcare, and it is still your legal right in New York State. Planned Parenthood of Greater New York will continue to offer you the full range of abortion options, whether it's in-clinic or medication abortion, because that is what you deserve. We need the support of our representatives. We must ensure a Medicaid reimbursement increase for sexual health services, including abortion. The fiscal year 24 budget must include the $25 million investment proposed by the governor to continue critical grant funds for abortion providers and those seeking care. And we must pass legislation to establish the Reproductive Freedom and Equity Program. Planned Parenthood will remain committed to doing whatever we can to ensure patients can access the abortion method of their choice with as few barriers as possible. Now I'd like to turn it over to Dr. Gabriela Aguilar, Medical Director at Planned Parenthood of Greater New York.
Good afternoon. My name is Dr. Gabriela Aguilar, and I'm a licensed, practicing, and proud sexual and reproductive health provider. And I can assure you that this court decision does not change the science. Patients trust us to provide them with the most advanced, evidence-based healthcare options available. The use of mifepristone is medical best practice, and it is used in nearly half of all medication abortions in the United States. Not only is mifepristone used to ease the experience and improve the effectiveness of medication abortion, it is also medical treatment for miscarriage. It is cruel to take away medical best practice from anyone seeking healthcare, but especially to those experiencing pregnancy loss. Forcing the FDA to withdraw approval for mifepristone physically punishes people for their pregnancy outcomes. This is especially true for marginalized communities that have long been denied life-saving healthcare. There's no denying that the alarming rate of Black maternal mortality is a symptom of inequality in healthcare access. When compared to their white peers, Black women are more likely to experience harm and mistreatment during pregnancy, and we can expect this to continue or worsen if mifepristone is removed from the market. Additionally, studies show that transmasculine and non-binary people are more likely to experience unintended pregnancy than their cisgender peers. Despite all of this, a Texas court reversed 20 years of advancements in medicine and decided on behalf of our patients that they do not deserve compassionate healthcare. This is dehumanizing. The FDA approved the use of mifepristone for abortion in 2000 and expanded its availability based on its medical safety and efficacy. The World Health Organization includes mifepristone and misoprostol on its list of essential and life-saving medicines. Medication abortion, with and without mifepristone, is safe and effective for virtually anyone who needs to end an early pregnancy. Planned Parenthood of Greater New York will continue to deliver on its commitment to care no matter what by offering our patients the full range of abortion options, including in-clinic procedural abortion and medication abortion. If we are forced to stop using mifepristone, we will immediately shift to a safe and effective misoprostol-only regimen. The misoprostol-only regimen is highly effective and meets Planned Parenthood's high-quality medical standards and guidelines. It is also common practice in many places across the world where mifepristone is inaccessible. Everyone should have the ability to make decisions about their own reproductive lives and futures, including choosing the method of abortion that works best for their circumstances. No judge, court, religious group, or political party should make that decision for them. Now I would like to offer a few words in Spanish. La decisión de la Corte en Texas no cambia la ciencia y el hecho de que la mifepristona es una opción segura y eficaz para el aborto y el tratamiento médico del aborto espontáneo. Es inconcebible que un juez que no es profesional de salud haya revocado 20 años de ciencia basada en evidencia como parte de una agenda antiaborto políticamente motivada. Planned Parenthood de Greater New York continuará cumpliendo con su compromiso de cuidado médico, pase lo que pase, ofreciendo a nuestros pacientes la gama completa de opciones de aborto, incluido el aborto en clínica y el aborto con medicamento, utilizando otro régimen seguro y eficaz. Todas las personas deberían tener la capacidad de tomar decisiones sobre su propia vida reproductiva y su futuro, incluyendo la elección del método de aborto que mejor se adapte a sus circunstancias. Now I'd like to introduce Neharika Rao, co-founder and lead organizer at Reproductive Justice Collective New York.
Thank you, Gabriela. Hello all. I speak today on behalf of the Reproductive Justice Collective of New York, a youth-led advocacy organization fighting for reproductive access for all young people in the state. We've been fighting for legislation that would mandate medication abortion pill access on campus across New York. And this decision further places barriers on students and young people who are struggling with the lack of access to a basic form of essential healthcare. Young people like me already faced increased barriers to abortion care, including travel, distance, cost, and stigmatization. And medication abortion offers a private way to have an abortion. As an abortion doula, I've supported multiple young people in New York who've told me how grateful they are that they can have an abortion while in a dorm, while sitting in their class, while being supported by their friends, and while being able to engage with their familial responsibilities. Already, medication abortion care is exceptionalized in student primary care and insurance settings. And this decision further represents restrictions that are entirely politically motivated and not based in science. Like folks before me have mentioned, if misoprostol is eventually removed from the market, my peers and I will be directly affected and our health choices placed in a perilous position. We expect New York universities and providers to provide clinical staff with training on the misoprostol-only regimen, as well as how to communicate to patients about the impact of the misoprostol-only protocol. We will not let this case deter us from demanding reproductive care for young people who continue to face these unique barriers to abortion care across New York.
Thank you, Niharika. Now I'm very excited to welcome Governor Kathy Hochul to speak to us. I also want to remind people that if they have a question, we need to save them for after the speakers, and please put them in the Q&A box with the name of your outlet. Thank you.
Well, thank you, Deepal, and I'm very honored to be here today. And thank you, Wendy, our president of Planned Parenthood, and your entire team that are working so hard on these issues. Delighted to see our incredible Attorney General, Tish James, who we're working so closely on this very issue with. We just got off the phone. I know that Assembly Member Jessica Gonzalez-Rojas has put her heart and soul into dealing with these crises, really basically a crisis right now as well. And great to see our Speaker, Adrienne Adams, as well. And I think we'll be joined by the mayor. But I want to thank, first of all, Planned Parenthood of Greater New York for everything you do, not just to protect the health and well-being across our state, but also the rights of our people. And when it comes to reproductive freedom in this country, we are right now facing historic, horrific setbacks. Just 1 year ago, women in this country had a constitutionally protected right to an abortion. And then in June, with the Dobbs decision, we are forced to confront a painful reality that the fundamental rights that my grandmother's generation had to fight for were stripped away with one decision. Now, the mega anti-abortion extremists, legislators and judges alike, are hell-bent on continuing down this path. They're coming after all forms of reproductive health care, and they took their latest step just on Friday with the ruling that'll further limit access to misoprostol and for millions of women across this country. One judge in Amarillo, Texas, thinks he knows better than thousands of doctors and scientists and experts, and not to mention the countless women who've used this medication safely for decades. So this isn't just an attack on abortion, it's an attack on democracy. Courts have never before revoked a science-backed decision made by the FDA. And if this decision stands, it could have unprecedented consequences that reach far beyond abortion, threatening the FDA's critical role in our country's public health system. So, this moment calls for bold leadership at every level of government. And I'm glad the Biden administration came out so strong against this ruling, and we've been standing shoulder to shoulder with them. And at the state level here in New York, we're not going to let one extremist judge turn back the clock on more than 20 years of safe reproductive care. New York has always been at the forefront of this fight. In the wake of the Dobbs decision, we allocated $35 million to reproductive health care providers. We mandated all insurance companies doing business in New York cover abortion. And I signed a package of legislation protecting providers and our patients. And last year, the attacks were on abortion procedures. This year, medication abortion. What's next? Contraception? Birth control? Well, I'm here to say, not in New York, not now, not ever. So last year, we called an extraordinary legislative session. We took one step closer to passing New York's Equal Rights Amendment. The ERA, as written, will enshrine abortion and contraception rights and protect all forms of reproductive health care in our state constitution. The ERA and these fundamental rights will be on the ballot next year. Once again, states have become the battleground on these fights. And one latest steps to tear down these rights have only strengthened our resolve. So I'm proud to announce that New York State will create a stockpile of misoprostol, another form of medication abortion. Extremist judges have made it clear that they won't stop at any one particular drug or service. So it's going to ensure that New Yorkers will continue to have access to medication abortion no matter what. We're also announcing that if this decision stands by this judge, we will dedicate up to $20 million more for reproductive health care providers beyond our current $35 million to support methods of access to other forms of care, including procedures. And we're in conversations with the legislature right now about requiring private insurance to cover medication abortion as well when it's prescribed off-label. All this is in addition to actions we laid out in my proposed 2024 budget, which increases the Medicaid reimbursement rights for reproductive health services, provides more funding for providers, and allows pharmacists to prescribe birth control, as well as implementing data privacy protections and expanding abortion access on SUNY and CUNY campuses. We'll always protect access to reproductive health care and all individual rights here in New York. It's part of our legacy. And in fact, abortion was legal here in New York 3 years before Roe v. Wade was even decided. So as long as I'm governor, New Yorkers will have access to the care they need when they need it. And we'll continue to open our arms to all people seeking freedoms and autonomy. And it's important that we're still fighting this fight yet again. But here we are with all of you, our partners, suiting up for battle in partnership. Let's continue and let's win this fight. Thank you, everyone.